Hello, welcome back. We are going to now talk about the specific principles of ethics. And again, I'm Dr. Jamie Pomeranz, and I'm happy to be here to talk to you about these principles. So the first one, what many people are familiar with, is autonomy. And, the basic form of autonomy is your right to self-determination, your right to make a choice. You decide what you want to do, and you are free to do it based on what you want, not what other people are telling you to do. So even if, let's say, a doctor gives you different choices about your treatment, ultimately you're the one who's making that decision about the treatment, not the physician, not your friends, not your family. Making sure that your rights are preserved to choose the act in accordance with your own wishes. So although people have the freedom to make choices, the ability to act on those choices is limited by the autonomy of others. So this is really interesting that a lot of people don't realize, is that just because you make a decision doesn't mean that you are having full autonomy, and that other individuals can affect your ability to make those decisions, which in turn violates your ability to have autonomy. So there's three typical necessary conditions for you to be able to make an autonomous decision. Number one is voluntariness. And what is voluntariness? It just means that you have the ability to make that decision. You can choose to make that decision on your own. The second one is competence. Are you able to make that decision? Does that mean, do you understand the information that's being presented to you so that you can make a decision? Because if you're not competent to understand what's being presented to you, then the decision you're making may not be what's in your best interest. You may think it is, and although you can make that decision, you're not getting that full level of autonomy. And then finally, the full disclosure of information. So all the information is presented to you. You have everything that you need to know to make a decision. And so I want to give you an example. So let's say you're getting cancer treatment, and the physician is recommending that you get chemotherapy, and he wants to know, is this something that you want to do? But he doesn't mention to you the different side effects that are associated with the medications that you're going to receive. And so you go ahead and you say, yes, I want the chemotherapy, and ultimately you get sick and you realize this isn't something that you wanted. You made a decision, but it wasn't a completely autonomous decision because you didn't have all that information. And that was limited by what that physician wanted to provide to you. So that's why we talk about limited by the autonomy of others. Next, I want to talk about non-maleficence, and many of you probably have heard of non-maleficence, and of course this is avoiding doing harm. We don't want to harm others. We refrain from actions that might risk hurting our clients. It's not necessarily something, we typically, of course, we're going into these health professions because we want to help people. And so we're not looking to actually hurt them. But a lot of times this could be something that ends up being passive. And take that example that I gave to you before. The physician decided not to give you the side effects associated with those medications, which ultimately ended up causing you harm. So that is a violation of non-maleficence because in essence he is causing harm. And we're going to talk about beneficence because that's where we struggle with an ethical dilemma. How do we decide on beneficence versus non-maleficence? And I'll talk about that in a few minutes. But the main thing is you want to avoid putting others at risk. But what goes with it, non-maleficence, is sometimes you need to balance how much the benefits outweigh the risks. So a lot of these principles you're going to see intertwine. But I'll talk about more of that as we kind of go on. So let's talk about beneficence. So of course, beneficence is contributing to the well-being of others. And we want to make sure that you grow, that your clients develop, your patients make their decisions and do well. It's a very active concept. It's basically I'm treating you. Somebody is hurt, I provide treatment, that somebody's going to help you. If I'm administering a medication, if I'm providing counseling to you with the goal of improving your well-being, then I am applying the principle of beneficence. It's a very active concept. So you remember we said non-maleficence is a passive concept. So sometimes we're struggling because we want to help someone, but we also have that risk of causing harm. And so we struggle in terms of what should we do? Should we help them, but we know that it's going to cause more problems and it might give somebody a false sense of hope and they might end up not doing well in the long run? Or do we go ahead and take a chance because this is something that we believe? And so when I talk about intertwining principles, you can think about autonomy, beneficence, and non-maleficence. So if I'm presenting to you all the information that you need to know to make your own decision, and then you make that decision, that would be autonomy. And if I tell you the side effects of, let's say, this chemotherapy, and you ultimately decide you still want to get it, and then I give you the therapy that you need, which is going to help you. So that's where those three principles are coming into play. And if any of those principles are violated, that's when we are stuck in some type of ethical dilemma. And so in summary, it's a general society obligation to provide mutual aid to members of society who are in need of assistance. And most of us do this. When we see somebody hurt on the side of the road, most people don't want to just drive on by and do nothing. Maybe they'll stop, maybe they'll call 911. As our society, in terms of our morals, we want to help people. We don't leave people, especially if they're hurting or they're suffering. Now, with beneficence comes a risk for paternalism. And paternalism, just like it sounds, you think about parenting and wanting to take over the care of someone and make decisions for them. So the problem with paternalism, where we're making decisions for people, we often can violate autonomy. And actually, the individual finds that they may not even want to make a decision because they want you to make a decision for you. And it can undermine your dignity. And we've all been there. Sometimes we just want to be told, what do we need to do? Just tell me what I need to do, and I'll do it. But ultimately, you're the individual who has to make that decision. So we struggle with providing enough information for you to make that decision and making that decision for you because we know what's best for you. And you think about with a child, we are often faced with paternalism because we're trying to help our children. We don't allow them to make their decision because we know what's best for you. Now, there are some times when paternalism is justified. Competency is seriously limited. So this could be somebody with traumatic brain injury or cognitive difficulties or inability to communicate. Counselor has the ability to promote the client's best interests. There's some arrangement or agreement that you are going to make these decisions for somebody. The client's interests are considered primary, or there's a risk for loss that must be real and significant, meaning that if I don't intervene, then there could be a serious problem. So let's say somebody's in an abusive relationship and you recognize that they're in this abusive relationship, but the individual's not doing anything about it. And you start to recognize that there's a real risk that something could go seriously wrong and you need to intervene, and your goal is to help this person, but ultimately you're making that decision about how this person is going to handle this situation. So I just wanted to give you an example of a case of paternalism. So a family physician does not fully inform Mr. Smith as to the seriousness of his illness and how the consequences of the various alternative treatments might affect his life. So you have to ask yourself, why is the physician not providing all the information that is necessary? And it's kind of similar to what I was mentioning before. And basically the physician feels that they know what's the best interest for Mr. Smith. But by making those choices for him, any consequences or alternatives that might have been available are no longer on the table. So it takes away that individual's right to make their own decision. All right, I want to show you, oftentimes we're faced with an ethical dilemma between autonomy and beneficence. And just to remind you, we're trying to decide whether or not we should make a decision for someone or allow them to make that decision. And as we mentioned before, it's going to be based on whether or not someone is capable of making that decision, how competent they are, do they have all the information they need to make that decision, and do they have the ability and the voluntariness to make the decision as well. But I want to point out that they're very opposite, autonomy and beneficence. And so if we do allow someone to make their decision, are we ultimately giving up the beneficence principle and doing it for them? And so I want to kind of show you how they intersect and how, as we move away from autonomy, we get towards beneficence. And as we move away from beneficence, we get towards autonomy. So I'm just going to show you a visual. I'm just going to draw this out here. And imagine that autonomy is up here, okay, and beneficence is down here, okay? Now, if let's say that someone needs treatment, okay, say they're trying to make that decision about whether or not they should get chemotherapy to treat cancer, and they decide they have all the information and they ultimately make the decision whether or not they want to do it or they don't want to do it. So they're going to be up here, right? That's going to be complete autonomy. They've made that decision. Now, let's say we really want them, I'm a doctor and I really want them to get this treatment because I think I know what's best. And so I don't offer all the information. I basically say, well, chemotherapy is going to help you, but I don't mention anything about the side effects. What are the chances that the individual is going to do better? I just know that as a physician, this is going to be the best option. So ultimately, I make the decision for them and they agree to get the chemotherapy. So that would be down here, right? So what I want to point out is when we go from autonomy, if we start to head down and start taking away the individual's right to make their decision, we are ultimately getting down here to beneficence, okay? Same goes for here. As I start to give them more information so that the individual can make an autonomous decision, we are getting up towards autonomy. So, high autonomy, low beneficence. And so I just wanted to show you a visual depiction to show that you can see the differences between the two, because oftentimes we are faced with this dilemma. Do we provide the information? Do we help the individual? Or do we make sure that we give somebody the information so that they can make that decision themselves? And that's it. Hope that helped. Thanks. Let's talk about justice for a minute. We're all pretty familiar with justice. And when we think about justice, we think about equality. And we make sure that everybody is treated equally, regardless of sex, race, ethnicity, disability, socioeconomic status, cultural background, religion, or sexual orientation. So ultimately, it's fairness. It's treating everybody in society the same, everybody having equal rights. And this is a strong moral value in our society. And here's some of the main principles of justice: equal sharing, making sure that everybody with needs have their needs met, that our motivation and effort is equally distributed, that we aren't motivated to help certain people but not other people, especially if we're dealing with the same condition or same situation. Contribution. We are looking at equal contribution into different areas of society or whatever area that you're focusing on. Free market exchange, you've heard this quite a bit, that as part of our justice, that everybody has the right for free market. They can sell, distribute, as long as it's legal, different types of, it could be medications, different pharmacies can sell medications. So by limiting one group from free market, you are violating that principle of justice. And fair opportunity. And this is a fundamental need. Person will be harmed if the need is not met, takes priority. So making sure that everybody has their fair share. If you are looking to accept students into a medical school program and certain individuals don't have the means for taking an entrance exam, they're not getting that same opportunity that someone who has the means. And so either somehow the individual needs to receive some way of being able to take certain tests, whatever information is required for medical school, to make sure that everybody has the same fair opportunity. So a lot of times when we're trying to decide, unfortunately, on justice and we're trying to evaluate that we are being just, we look at some quantitative criteria for distribution of justice. How cost effective is it? You know, we want to help everybody, but what if we can't afford to help everybody? Then we might be limited, you know, and so we want to help, let's say there's a vaccine for for some disease, that's part of this epidemic, but you are limited in the amount of vaccines that you have. So you don't have the ability to give everybody the same vaccine. And so you have to make a decision, what is the best choice that you have that is the most fair? Thinking about quantity as in everything, that's something that really we struggle with justice in terms of we can't think of numbers, we can't measure human dignity. Everybody should have equal rights, but unfortunately in our society, we are seeing that certain people don't have the same rights. Efficiency ignores common values, example, hospice, etc. So this is a struggle. We think about if somebody's in a hospital and they're getting treatment, but we know the cost for treating them is extremely high, and we recognize that they have a terminal illness, that they may not make it. Instead of continuing to treat them, we move them into another location. Could be hospice care, because from a cost effectiveness, it just happens to make sense. So it's a real struggle, and that's where oftentimes we'll see a dilemma, an ethical dilemma associated with justice. Now, one area that we see a constant challenge associated with justice is age. We are a society where we have a lot of technology, a lot of new health interventions. People are living longer than they ever have. But the question comes, who is more valued? Somebody young or somebody that has lived a long time? And should those two individuals have the same rights and equal access to certain types of treatment? So for example, an 89-year-old patient gets a heart transplant because he or she is higher on the waiting list to receive a heart transplant than a 10-year-old girl. Some might say, yes, she is higher on the list. However, this individual may only have 5 more years to live, where a 10-year-old girl hasn't had an opportunity to live. They've got a full life ahead of them. Shouldn't we prioritize those treatments for someone who is going to benefit the most? And so here, again, going back to what I said before, it's very difficult to quantify human life, to put a value on human life at any age. And so this oftentimes has become a struggle. It's continued to be a struggle in terms of priority for aging folks, especially compared to young people with the same needs. Here's another example. Should a pregnant 39-year-old single parent get a heart transplant because he or she, well, obviously it's a she, is higher on the waiting list to receive the heart transplant than a 10-year-old boy? So now we're faced with this situation where you're actually taking care of two people, the individual who needs the heart transplant, but also their pregnant unborn child versus a 10-year-old boy. So now if we're trying to quantify, are we looking at it as, well, now we have two people that we can ultimately affect versus one person, a 10-year-old boy? And you're probably wondering, what is the answer? And I can't tell you what the answer is. All I can tell you is that this is something that is a struggle, something that we have to evaluate. And we're going to talk later about ethical decision-making models and how we can ultimately find out what it is, how do we make these types of decisions. Another example, which disaster patients get treated first? And this has happened quite a bit actually in real life. We've seen this we've had a lot of horrific events like earthquakes, hurricanes. And so here's an examples. Room number 1, severely injured patients not expected to live. Room number 2, severely injured patient most likely to live if treated. Room number 3, injured patients will live but will suffer varying degrees of disabilities if not treated promptly. Who do you see first? So this is a really tough one. And, we hear about triage in terms of ERs, but this is a little bit different. Triage really is based on who actually needs the treatment the quickest in order to survive. But looking at this, we've got an individual that is not expected to live at all versus someone that may or may not live, but probably will. And then somebody, if they do live, they're going to be severely have some severe functional limitations and be living with a severe disability. How do we quantify where we should go? Who should we help first? How do we make those decisions? Emergency care, 2 patients in critical condition. Who gets treated first? First patient who walks through the door, the younger patient, the patient most likely to survive, patient who can pay for services, and patient with the most serious condition. So again, we talk about triage, and this is basically putting people who need to be treated the quickest or the most serious of their condition are going to get treated first. But here we've got something else happening. We've got this who can pay for services issue. And our society suggests that we help everybody, that we aren't going to discriminate based on your ability to pay for types of services. Do we focus on the most serious condition? Do we look at somebody who's most likely to survive? Young patients? And this is why a lot of times we'll see pediatric hospitals being developed so that we don't have to struggle with these types of decisions. And also, is there something to be said about the first person that walks through the door? So here, we are trying to quantify justice, which is very difficult when we're talking about human and human dignity. So that pretty much covers the basic principles of ethics. I appreciate the time to talk to you guys, and I hope to talk to you soon. Thank you.